Good evening, everyone, and welcome to the December 16th, 2024 Grafton Board of Health meeting. As a preliminary matter, this is Jennifer Maynard, Chair of the Board of Health. Permit me to confirm that all members and persons anticipated on the agenda are present and can hear me. Members, when I call your name, please respond in the affirmative. Don't see Yvonne. Dan Finn.
Dan Finn here.
Karen Gwastowski-Govin.
Karen Gwastowski-Govin here.
Bill Mueller.
Bill Mueller here.
Staff and anticipated speakers. When on the agenda, when I call your name, please respond in the affirmative. Nancy Connor's voice does not work, but I see she's here and she confirmed her attendance. Let's see. Amelia Houghton.
Here.
Ian Wong.
Ian Wong here.
Molly Scannell.
Molly Scannell here.
Devon Thornton.
Devon Thornton here.
Maddie Castile.
Feel here.
All right. I don't think I missed anyone. Did I miss anyone? Okay. I'd like to open the meeting. Can I get a motion to open the meeting?
This is Dan Finn. I'd like to make a motion to open this meeting.
Is there a second?
This is Bill Mueller. I second that motion.
Roll call.
Dan Finn, aye. Bill Mueller, aye.
Karen Gwastowski-Govin, aye.
Aye. Okay, this open meeting of the Grafton Board of Health is being conducted remotely, consistent with the act extending certain COVID-19 measures adopted during the state of emergency. This act includes an extension until March 31st, 2025 of the remote meeting provisions of former Governor Baker's March 12th, 2020 executive order suspending certain provisions of the open meeting law. In order to mitigate the transmission of the COVID-19 virus, the act extends the requirement of the open meeting law to have all meetings in a publicly accessible physical location. Further, all members of public bodies are allowed to participate remotely. The order, which you can find posted at the town's website at www.grafton-mass.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along to the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. There are no public hearings scheduled for this evening's meetings. If the public does have questions or comment on an agenda item, please utilize the Q&A feature in Zoom. Please include your full name and address when submitting a comment. For this meeting, Grafton Board of Health is convening by video conference via Zoom as posted on the town's website, identifying how the public may join. Please note that this meeting is being recorded and that some attendees are participating by video conference. Accordingly, please be aware that other folks may be able to see you and to take care not to share your screen of your computer. Anything that you broadcast may be captured by the recording. Any supporting materials that have been provided to members of this body are available on the town's website unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I note otherwise. Before we turn to the first agenda item, permit me to cover some ground rules for effective and clear conduct of our business and to ensure accurate meeting minutes. I'll introduce any speakers on the agenda for a topic. After they conclude their remarks, I'll invite the board members to provide any comment, questions, or motions. Please identify yourself by name when speaking. Further, please remember to mute your phone or computer when you're not speaking. Please remember to speak clearly and in a way that helps generate accurate minutes. For any response, please wait until I yield the floor to you and state your name before speaking. If members wish to engage with other members, please do so through me, taking care to identify yourself. Finally, any votes on any motions made during this meeting will be conducted by roll call. Okay. Feel like it maybe gets a little shorter each time I do it. Probably not. Okay, here we go. I don't think Yvonne is present tonight. Wait, there's somebody. Let's see. Nancy, is that you called in or dialed in? You can text me. There is a call-in user.
Is Kyle on?
I don't see a Kyle.
Okay.
Nancy, just let me know if that's you. Yep, that's Nancy. All right, so Nancy's listening along. I'll allow you. I'll allow you to talk in case you want to, but please feel free not to, since we know you're not feeling a little under the weather. I will turn it over to the Alliance team for your update. Who would like to go first?
So I would like Molly to give out the nursing report.
Great.
Okay, this is Molly Scannell. For COVID updates, which is usually what we start with, COVID numbers are remaining steady at the moment. For Grafton, there were 8 reported cases in November, and coincidentally, there were 8 reported cases in October. So if that's not steady, I don't know what is. It's a bit surprising. The BioBot analysis wastewater summary does indicate a slight rise in results, which is expected for the season. We did have 3 reported cases of pertussis, 2 in the Grafton Middle School and 1 in the Grafton Elementary School. So a pertussis advisory did go out to parents of the middle school and the elementary school. And I know this 3 doesn't sound like a big number, but with pertussis, the infectious period is so long. It's 1 week prior to symptoms beginning and 3 weeks after that without antibiotic intervention. So an advisory really is important right away, just to for parents to be aware of symptoms so that they can start their kids on antibiotics, and also so the family can start prophylactic treatment if they've been exposed. So I know 3 doesn't sound like a big number, but that's the reasoning. There was no reported flu actually for the month of November in Grafton.
Quick
And
question on that, Molly.
COVID.
Sorry.
What
On
was
the,
that?
on the pertussis, we have a couple of elementary schools in Grafton. Which one?
Oh, it's just Grafton Elementary School. I'm sorry, I don't know. I apologize. I can get that to you though tomorrow.
That'd be great. Thank you.
Okay. Hospitalizations for COVID mildly fluctuate weekly. To prevent respiratory illness, masking and practicing hand hygiene and vaccinations according to your provider's recommendations is still the best deterrent. As discussed last month, there was an uptick in walking pneumonia cases, specifically for school-age children and young adults. The state health department is aware of the increase in cases, and they're monitoring emergency departments and outpatient visits pertaining to pneumonia, but it's not a reportable illness to local boards of health. For the arbovirus updates, Central Mass Mosquito Control Project, the arbovirus season is over, but the Board of Commission has posted their schedule for 2025. And let me know if you're interested in that early at this time, and I can ask Amelia to email that attachment if needed. But the arbovirus season, I believe, begins in April. So it's currently not relevant right now, but they do have the schedule out. Other updates for Grafton, DA presentations for seniors at the Grafton Senior Center is coming up in the spring. And the first topic will be scams targeting seniors. This is being planned for April 15th, 2025 at 10:30 a.m. More information and flyers to follow, but this will be a standing presentation for Grafton every 6 months with a new relevant topic every time. We are planning a follow-up / round 2 shingles and RSV vaccination clinic for late January or early February. The date is to be determined still. Shingles is a 2-part vaccine. So those that were vaccinated at the September 27th clinic in the municipal gym will have the opportunity to get that booster at this upcoming clinic. So it's given a few months later, about 3 months later. The nursing department is currently interviewing for the regional public health nurse position, and hopefully that role will be filled in January. And just some national and international updates. The international outbreak of Marburg virus, which I mentioned last month, continues, and it has actually spread from just Rwanda to include Ethiopia. Marburg, it's a serious viral hemorrhagic fever similar to Ebola. It can cause serious illness and death. It's specifically associated at this time with hospitals in Kigali, where 66 illnesses and 15 deaths were reported as of November 11th. Most of the cases are healthcare workers working in intensive care units, and there's no cases of Marburg outside of Rwanda or Ethiopia, so the risk to the US remains low. Arupuchi outbreak continues in the region of the Americas. I did not mention this last month, but Arupuchi is an arbovirus infection, meaning that it's carried by mosquitoes, and it's been found to circulate in Central and South America, as well as the Caribbean. It's transmitted to humans from a particular midge and certain species of mosquito in forested areas and near bodies of water, similar to West Nile. The disease symptoms are similar to dengue fever, though, starting 3 to 12 days after an infected mosquito bite. The onset is sudden, and usually cases present with fever, intense headache, joint stiffness, pain, chills, and sometimes persistent nausea and vomiting up to 7 days. Some cases have a relapse in symptoms, but after the fever stops, but most cases resolve in about 7 days, with rare convalescence lasting for weeks. There's no specific antiviral treatment or vaccine for Arupuchi, and the concern is always for vulnerable populations, including pregnant people who can pass the virus on to the fetus. Prevention is like West Nile or Tripoli, which we're familiar with here. It's to to avoid forested areas and bodies of water with known mosquito activity, and to avoid mosquito bites if possible. And then last is we have an Mpox update. The US and Canada have confirmed travel-related cases of clade IB MPXV, which is a recent strain of Mpox. The World Health Organization was notified of the first case of this particular strain on November 18th. The case is an adult male in California who reported recent travel to locations in East Africa. Symptoms include fever, swollen lymph nodes, and pustules on multiple parts of the body. The source of exposure of the case is unknown at this time, but all healthcare and travel contacts have been monitored for 21 days, and no additional cases have been identified at this time. So still risk remains low, but it has been identified in the US. Any questions? I think at this time it's safe to keep eating baby carrots. I mentioned that last month. And last month we mentioned the E. coli outbreak in McDonald's cheeseburgers. So you're good to go on those as well.
Good for burgers and carrots. Great.
Burgers and carrots, go ahead.
Very good.
Okay.
Thank you, Molly.
And I'll email the which elementary school was affected by pertussis tomorrow. I apologize for that.
Oh, that's all right. And our makeup of schools are every community is different. I'm sure we just happen to have a few of them.
Okay.
Till they get to the middle school, then they all merge together. Yes. Let's see who's up next from the Alliance. Thanks, Molly.
Devon. Oh, Devon, can you give your update?
Yes. Good evening, everyone. This is going to be short. December's inspections is a short month for inspections. For this month, there's been 7 comprehensive food inspections. I think for the month of December, I have maybe for just December 4 left for the month. We've received 1 complaint, but it was a zoning issue. I think the building department handled it. It was at 7 Birch Street, and had to do with some cows at the property and manure. Animal control addressed the issue. I didn't receive a copy of the agenda, so I'm not sure if there's any more complaints listed on the agenda that we haven't covered or discussed.
Don't think so. Did anybody see anything that they wanted to flag?
Mm.
I think we're good to run.
Okay, and I just wanted to know if we mentioned this last meeting. We did receive complaints from the state about 2 residents in town that were promoting selling food in their own homes. And we were going to send letters. We found their contact information. We're going to send letters to both residents explaining that they're not allowed to sell food at home. So I don't know if we mentioned that or not. So that was another complaint we received at like around the end of November.
Don't think we got that one, so thank you for flagging.
Okay.
Nancy, did you want to chime in? Your hand is raised if you do. You're probably signaling that she's going to circulate something to us. That's why we have limited questions today.
I think Dan has a question.
Yeah, this is Dan. Thanks. Devon, were those 2 separate outlets or homes, or obviously 2 people, but were they at one location or 2 different locations?
Two different residents. One resident, we actually found their information on, they were kind of marketing themselves on WhatsApp.
Oh,
And both residents, one was just promoting that they were just promoting their recipes and taking pictures of the food that they prepared. The other resident was actually promoting that they sell food, and the cuisine was Indian cuisine. So we were just going to send letters out, letting them know that they're not allowed to have residential kitchens in their home to cook and serve to the public. And I guess they were going to deliver the food. They promote on WhatsApp and then deliver the food.
So they'll have to, I assume, if they want to pursue it, they'd have to get a permit and have it be inspected and
Oh yeah,
all of that through Nancy's office. Okay.
they would have to be considered they would basically have to have a commercial kitchen in their home in order to prepare that type of food.
Right. Thanks.
any other questions for Devon?
And I think that's all we have to report on the environmental health side.
Thank you.
Unless you have any
Devon.
questions.
Hopefully you can have like a couple days reprieve in December. Your last couple of inspections. Great job. Let's see. Who else from the Alliance? Any other updates? I think we usually, Molly covered all the respiratory and other potential things. Devon did our usual inspections update. Any updates from the opioid settlement group?
Yeah, I can start that. And our last meeting, I wasn't sure if we had a meeting between the Board of Health meetings. I kind of get lost in how many meetings we go to. But I think, Board of Health member Dan, you were bringing up about the sober housing that you were looking into in the opioid. So I don't know if you want to fill that up, or the status of where you are with that.
Sure. This is Dan. Yeah, and I think I did report, but just that we found that there are 3 separate sober or clean homes or groups in Grafton. One is in South Grafton, and it's has 16 residents, 4 apartments, and the main counselor of that hopes to come to our meeting tomorrow and just tell us how things are going and what they do and if they need any assistance. And then also there were 2 other groups, one in Grafton, Providence Road, one in North Grafton up at Forest Lane, that have let's see, 20 apartments each with a total of 20 residents in each. And they are generally managed by Riverside out of Milford with Massachusetts mental health funding and counselors. And at some point in time, we may want to have them come and just tell us what they're all about. And if they need any advice or assistance, or if they have any information for us that might be helpful. So tomorrow we'll have more information after tomorrow's meeting, I think, on all of that.
Thanks, Ed. I know they're on the agenda for tomorrow. The other discussion we had at the last meeting was the distribution of naloxone boxes and naloxone throughout the town of Grafton. So we're looking into that right now, putting that together. And the other piece too, we've been working with grandparents and parents who've had someone who's gone through lived experience. So we're putting in support groups for grandparents. And then one of the members are working on that one. And I'm looking at the agenda notes. That was the big three topics I think we talked about. And tomorrow we'll pull together some more programs that we're planning on doing. And that's what I have in my notes. Anything, Dan or Bill, that you can remember?
I think the only thing I'd add to that is that we have been successful in getting representation from the other towns in the cooperative that we're part of. We've had representation from Shrewsbury and from West Boylston. And I think that's been helpful as well, because the strategy is really to hire a coordinator, and this will be an expense that will be shared among the 4 towns of the organization.
And right now I'll be leading up the coordination for the towns. I know that, but I think those are the big things. And tomorrow we'll meet, talk about the people in recovery, the sober housing, the supports we have, and living with lived experience people, and moving ahead with the naloxone distribution in Grafton.
Do we have a tentative timeline for the position that we're talking about? When that might be something that we start to look to implement and using some of those funds, or it's still kind of early for that?
Are you asking about using the funds to do programs, or using the funds to hire the coordinator, to look for a coordinator?
Probably both. I would imagine the some of it we're using with the distribution of the naloxone and stuff like that, but for those other 2 pieces that haven't quite taken flight yet.
Yeah, right now that's where can do is start putting together the distribution of naloxone, do the programs. We don't need the coordinator for that. We just need the town just to put the programs together, because already we've done a couple of Narcan trainings in town, and so we're moving forward on all that. And I'll let you know about the coordinator.
Great.
We do hire that, but I'm taking on all that right now, and then we'll be handling that.
Great. Good.
Okay. And that's all I have.
Any other questions for, Karen? Any other questions, since the others are on that team already? Great. Okay, we have a couple of items to defer. I know this is going to be like the fastest meeting since I've started to be chair. Nancy will circulate to us. I know we have the fee schedule, but when we spoke last time, Nancy is going to make some recommendations for the edits to the fees. So we'll do that at our next meeting. I think we did the things that we wanted to get done through the year. And then similarly for our October and November meeting minutes, we will vote on those, maybe with our December ones for January. Is there any old or new business anybody wants to flag? I do not have any mail or correspondence to mention here. And then we have our meetings set through June. We are, as we said previously, going to be remote through March, which will get us through the winter weather, hopefully. Don't speak too soon. And then certainly we'll see if there's a change to the open meeting law, if it allows for hybrid or continued in remote, and see if we adjust that or if we reconvene back in person starting in April, which is what we currently anticipate. Anything else? Fastest meeting ever.
No, we've had like 15-minute ones, but I think they
Oh,
predate you.
not since
They-
I've joined.
They predate you and they also predate COVID.
Okay, see, there's that.
I think we had an 8-minute one once.
Oh,
Yeah.
wow.
You missed it, Jen.
Yeah,
Okay, well,
those were the
find,
days.
we'll find agenda items.
We'll find one.
Something tells me.
Yeah.
I bet Dan has something to say.
Yes, as a matter of fact, I'd like to wish everybody a Merry Christmas and a healthy 2025 and make a motion to adjourn this meeting.
I second that motion.
Roll call.
Dan Finn, aye.
Bill Muller, aye.
Karen Gustowski Govan,
Aye, and I will echo Dan's sentiments.
Mhm.
Happy holidays to all of you. We'll see you all in the new year.
Yep.
Be well.